Greetings, my dear friends. Again, I'm Professor Edin Debuago, a professor of public health medicine, working with a Community Positive Health Attitude Initiative to bring you information about the basic things you can do to stay alive, and then prevent all these preventable diseases. We are going to be talking about, we've had one episode about cancer of the cervix. Now we are going to talk about the symptoms of the cancer of the cervix. We're also going to, in this episode, talk about the types of cancer of the cervix. So the symptoms, what are symptoms? Symptoms are the things that the patient comes to the doctor and says, "Doctor, I am suffering from this, and that." It's different from signs that the doctor will find when he examines the patient. So these are the complaints that the patient comes to the doctor with. So these symptoms for cervical cancer, usually the symptoms do not appear early. By the time you start getting symptoms, my sister, is a bad sign. But the common symptoms when they do occur, you have what we call abnormal vaginal bleeding. This is bleeding that the lady experiences that are not the usual ones. And then you can have this bleeding first after intercourse, post-coital bleeding. When the woman meets with the husband or the partner, after that you see blood, you see traces of blood. It's not usual, Then you can have the woman having prolonged menstruation. Instead of the menstruation stopping, that is another abnormal vaginal bleeding. It continues. Some stop after 2-3 days, 4 days, but this one can go on for over a week. It's a sign that all is not well inside there. Then lastly, you can have bleeding occurring after menses. Usually menses come the cycle is every month. But you can have somebody having menses, 2 weeks later, another bleeding, or a week later. So these are abnormal vaginal bleeding. They are all signs that all is not well around. And once you start having these things, you need to see your gynecologist. Then the other classical symptom we have is painful intercourse. Painful intercourse, When the lady meets the partner, is in pain, it's not usual. Of course, the lady probably is not a virgin, but each time he wants to have intercourse, he's experiencing pain. It's abnormal. You should raise alarm. You should see your doctor. Of course, you have situations, what they call abdominal vaginal discharge. The woman starts getting, at times, brings out her undies, is wet. Some can be foul smelling. It keeps thinking it's infection. It's not always infection that gives you abnormal vaginal discharge. So it could be as a result of cancer. And lastly, the fourth last, symptom that you could see is when you start having persistent lower abdominal pain. At times it could radiate towards the back, to your waist and things like that. But again, if it is cancer and it's gotten to the stage of you having that persistent pain, it could be a sign that the cancer is spreading, and it's not a good sign. So that's why we keep advising and advocating. Make hair where the sun shines, so that you need these things in the bud. My dear friends, let's talk about the types and stages of cancer of the cervix. Remember, in our basic facts, we told you that generally, carcinoma of the cervix can start with just what we call dysplasia, cervical dysplasia, some little changes on the surface of the cervix that later moves on to what they call a carcinoma in situ, that we say can last for 8 years. So those are the preliminary stages. But when that carcinoma in situ is not handled and it goes to invasive carcinoma, that's really the area we are going to talk about, the types, and then the staging of the real invasive carcinoma. And then the types basically are two broad types. You have what we call a squamous cell carcinoma. This squamous cell carcinoma is the cancer. It arises from outside, like what they call ectocervix, from the cells outside the inside of the canal of the cervix. The cells outside actually that are close to the vagina. So that is where it arises. And you'll find out that most cases of cancer of the cervix start from there. Up to 80 to 90% of the cases of cancer are squamous cell carcinoma. They are the commonest. Then the next one is adenocarcinoma. This one starts from the cells inside the tunnel of the canal of the cervix. With columnar cells, it grows and is not as common as the squamous cell carcinoma. This one happens in about 10 to 20% of cases. But again, you can have the two of them coexisting. When you come to talk about the stages, the International Federation of Obstetrics and Gynecology, they broadly grouped, although there are some minor groups, but let's restrict ourselves to the four broad, stages of cancer. And stage 1 is when you have a cancer wholly located on the cervix. It hasn't gone beyond the cervix. Even if it affects a little part of the other part of the uterus, it's still in stage 1. But stage 2 is when you have a cancer going a bit outside the cervix and affecting the upper part of the vaginal wall. That is stage 2. It's easier to manage these stages. The outcome is usually better even if you get them at these stages. But stage 3 is when you have the cancer spreading, affecting the lower third of the vagina and then going to the lymph nodes. It can affect the ureters. These are the things that take urine from the kidneys into your bladder. Once that happens, it's stage 3 and it's bad. My dear ladies, my dear friends, stage 4 is the last stage and is a very bad one. You could have a cancer eating into the bladder, eating into the rectum, fungating, and it's really a very sorry sight to see women with a stage 4 cancer of the cervix. Very foul-smelling discharge, very offensive discharge, and the whole idea is to don't let your relations or anybody get close to having this disease progress to that level. A little information about how the diagnosis of cancer of the cervix is made. The diagnosis generally, doctor makes his diagnosis starting with history, good history taking. The doctor will find out questions, the lady's sexual life and all that. Then we'll go on to examine the lady, vaginal examination, digital examination, then do all that. By the time the doctors are trained to pick from the history and then the vaginal examination to have suspicion, they will have high index of suspicion if the person is having cancer of the cervix. And this will determine the further tests they will do. They can go on to do other, that's what they call examination under anesthesia. Maybe from their initial assessment, they will find out that there are indications that this possibly is a cancer of the cervix. They need to put the woman under anesthesia so that they can freely do a rectal examination, use what they call colposcopy, use spectrum, look into the cervix, and then find out how hard it is. From then, they now go on other supportive tests like X-ray. They could do an X-ray, find out if the cancer has spread to anywhere and all that. But primarily, when they do this examination under anesthesia, they take what we call biopsy. Biopsy is a piece of the cervix that must be sent for histology examination. Is this examination result that generally will confirm whether it is cancer of the cervix or not. And once that is done, and like I told you, and is confirmed, then the other tests like chest X-ray, can be done. There are other tests like CT scan, MRI, magnetic resonance imaging, PET scan, biomarker testing, a whole lot of them. There's even cystoscopy. It could come to a stage where they will have to use a cystoscope and look into the bladder and see how it is. So diagnostically, but the hallmark is good physical examination, good history taking, good physical examination, and then biopsy. The biopsy result is what we say whether the lady has cancer of the cervix or not. So that is it. And this information, of course, like I said, the doctors are well trained to handle it. But you, as the layman, as the patient, it's good you have this information so that whatever the doctor is doing, you help him. In fact, patients help doctors decide on their line of management a lot. He will ask you questions because your line of management, the extent of surgery that will be done depends on, we will talk about that in another episode, on whether you still want to have a child or not, whether you still want to be sexually active or not. So you need to be informed about these things so that you can make informed decisions. We usually don't end any of our episodes without giving you this advice. This is a message from us, from the Community Positive Health Attitude Initiative team. Cancer of the cervix is very curable. Your prognosis, that is the outcome, depends a lot on the stage at which you're picking this cancer. Do all you can to pick this cancer early and then handle them. And like we said before, the key preventive steps of picking this early is screening. Pap smear is everywhere. It's easy. It's just taking a little swab from your cervical canal and analyzing it in the lab. There are other forms of screening, but that one is very common. Again, you are advised to take the vaccine. We have human papilloma virus vaccine. Anybody, from 14 years, even 9 years in US and some advanced countries can take it up to 45 years, And this cervical cancer, you are advised to screen do pap smear every 3 years. Maybe when you get to 65 years and you haven't had a positive result for the last 2 times, you can stop. But these things are very affordable and easy. Please, we love you. And certainly your family, your friends, relatives, they love you so much too. Please stay alive. Do not say it's not my portion. It can be anybody's portion. Anything can happen to anybody. It's all in God's hands. Saying bye-bye to you, my dear friends. Remember, I'm Professor Edin Dibuago, your Professor of Public Health Medicine. Thank you so very much.